Value-based healthcare is a philosophy as defined by Michael Porter, where we relate clinical outcomes of treatment with the cost of delivering that treatment. So when you put the clinical outcome in the numerator and you put the cost in the denominator, we're creating ourselves a fraction that we define to be value. Important in value-based healthcare is, of course, that unit of analysis. And for us, this is clear. This is about the patient. So whenever you measure cost, whenever you measure clinical outcomes, it should be centered around that individual patient. And thanks to that central position of the patient, we see so many players in the broader healthcare field showing interest in this philosophy. Think about the hospitals, physicians, the medtech industry, but also pharma industry.
If you agree with the value-based healthcare philosophy and the measurement of value as the link between outcomes and costs, there are different possibilities to improve value in healthcare systems. The first three possibilities are straightforward because you could increase outcome with the same cost structure, or you could have the same outcome with an improved cost structure, or you could even have an improved cost structure with an increase in outcome. The first case studies show that even the third possibility is often implemented in our healthcare systems. There are also two less obvious ways to create value, because you could increase outcome with an increased cost structure and even create value, or you could decrease the cost structure with a decrease in outcome, but still creating value. And those last two are more controversial.
Healthcare budget is under stress, so we need to think wisely on how to spend our money in the healthcare system. A lot of attention is going toward bundled payments, and value-based healthcare can help us in better assessing its potential. Now, bundled also means integration, and we need to move towards integrated practice units, so moving away from that silo mentality. Well, having a view on the cost, having a better view on the outcomes and the linkage between the two will enable us to do a better job in the field of process improvement, but also to make better usage of our scarce resources.
If you want to implement the value-based healthcare philosophy, different components are important. The first component is that you select a medical treatment. We are, for example, working at this moment on breast cancer. We are also working on spine, and we are working on psoriasis. A second component is that you define outcomes. And there are different frameworks, a lot of international research done. And for example, Michael Porter also defines a framework there. What we think is important is that we use one common framework for every treatment worldwide so that we can benchmark also the outcome data. The third component, the third element, is the cost structure. This means that we need to be able to calculate the cost of a medical treatment and its variability. And what we do is we use time-driven activity-based costing for that. And in time-driven activity-based costing, we look at the resources. What we do is also we construct process maps. We have time estimates and time equations, and based on all this information, we can calculate the cost of a patient and the differences in cost structure for a medical treatment. The fourth component is the involvement of different people working in the healthcare system to do the analysis. We need to have the involvement of the medical people, the medical doctors and the nurses. We need the involvement of those people knowing the processes. And finally, we also need the involvement of the financial people, as a lot of financial data will be used to do the analysis.